Hello everyone, I'm Leslie Cornwell, Certified Nurse Midwife with Empowering Midwifery Education. This section has to do with quality improvement measures. A legal disclaimer we put at the beginning of all of our presentations. This information is for general and educational use only, not intended to substitute for professional, clinical, or legal advice. We strive to keep our information as accurate and timely as possible, but make no promises and guarantees it works for your unique situation. Course objectives, the student will be able to verbalize exactly what are quality measure improvements. They'll be able to verbalize the different uses of quality measurements. They'll be able to verbalize the different types of improvement measures available specifically to healthcare. They'll be able to verbalize the best practices for measuring and implementing those quality improvements. And the students will be able to verbalize the principles involved in a quality improvement process. This topic is really important when we're doing quality and we want to have the best outcomes possible. You have to have an objective measure. You have to have an objective stance for evaluating, for improving things. Objective data is so important because we want to get outside of the blaming people, and then you're less likely for people to bring things up. You need tools and you need strategies that are consistently being used to have an initial baseline, to have a benchmark, to have a reaffirming measure performance you want to hit and what interventions you're doing to make those happen. So it's not that we say, oh, we're having a lot of bleeding issues, we're going to collect all this data. What are you going to do about it and where do you want to go? We want to go from 20% postpartum hemorrhage down to 5% postpartum hemorrhage. How do we get there? What do we have to do? What interventions, what education, what system improvements do we need to do to make sure we meet our goals in incremental steps? So it's really important to have a groundwork for quality measures, for performance, for chart audits, for training, for regular, constructive, detailed reviews of interventions, and consistently making sure with shoulder dystocia and documentation and quality measures things are happening on these near misses and these poor outcomes so that they're less likely to happen again. So let's go to the basics. What are quality improvement measures? They're not designed to assess an individual's general practice. They are used to improve and evaluate an entire system, from the hiring process to the orientation onboarding system, from the charting, from the resources, the communication among the team when they're giving report to each other, talking to their clients, the educational handouts, what is being discussed during prenatal care, when they're admitted during labor, triaging a client, postpartum follow-up, screenings, resources, referring them to someone out in the community and making sure that it's following through. So there's a lot of things involved in quality improvement measures. And we have to determine what we want to improve, how much we want to improve it, and what things are we going to do, and see what happens with those system improvements. We're going to start doing some extra training. We're going to talk about the S-bar and communication. We're going to start adding some educational handouts. We're going to spend longer time with our clients during visits. We're going to start implementing more childbirth education classes and resources outside of our midwifery care. Like, what are you to do to improve those outcomes? What are the different things you can use this quality management data and resources for? You can improve standards, you can improve patient satisfaction, you can get accountability in a system as a whole, like just as much as the owner and the manager and the midwife and the birth assistant and the receptionist, everybody has a role in improving systems, from how we talk to clients to how we remind and we follow up. Who's in charge of the project management? You're going to delegate different things based on people's skill set within your team to make sure that someone is leading that project. It'll give them engagement. It'll be great with their evaluation. They have the marketing skills. They have the education skills. They can handle the patient intake paperwork because they're the front line that's going over it with those new clients, the nurses, the medical assistants. So you want to make sure you have a project management flow, you have a timeline, you have a step-by-step of how we're going to do things and work as a team. You want to make sure sure the goals are being met. You want to look at the quality improvement measures and have a direct tracking system. What interventions are we implementing and how much are they improving things or are they hurting things? You want to brag about your results. If you are doing amazing things, your clients need to know about it. Maybe you have silent investors and they're a little worried because you've had some near misses and the malpractice insurance cost is going up. You want to really show how you're improving outcomes. We want the healthiest moms and babies. And so maybe it's taking less clients. Maybe it's redirecting and focusing on a new marketing campaign so that we're getting more of your ideal client that's coming towards you versus you're getting some riskier high management things that have a high transfer rate. So you have to just determine, what are you doing? You've been bragging about how awesome XYZ is with the practice and how can we take it to the next level. So there's different types of improvement measures available in healthcare. There's based on outcomes, there's based on processes, there's based on balancing out roles and responsibility and delegation so that not one person is expected to do everything and you're wondering why things are falling through the cracks or it's just not happening. So balancing measures are determining, should we improve one part by replacing it with another part of the system? Should we change how we're doing things, the flow, maybe a new EHR system, maybe a new way that we're going to buy inventory and we're storing it and we're purchasing because too many things are getting expired. People are taking too long to try to find something, and that's valuable time. So based on safety, based on revenue, based on being resourceful with what you have, do we need to balance and rechange our entire system flow? Process measures, going step by step in detail. What does a patient intake look like? From how do they get a hold of us? Can they call? Can they send an email? Can they sign up automatically to schedule visits on the patient portal? How are we verifying their insurance? We're getting too many people with outstanding balances and not paying monthly payment plans. Like, how can we solve that problem? Getting people a good conversation with your biller, your financial person, to talk about their estimated responsibility, to make sure you have payment plans, they're paying ahead of time, their copays, their deductibles, your reverse billing, so they get a refund after you process the insurance. Like, you have to figure out where the challenge is with your practice and how do we solve it in a detailed process. What are we doing right? What are we not doing well? What are our ultimate goals and how do we fix the problem? And you want to do an outcome measure. You want to implement things and you want to see if it's helping. Is it fixing? Is it improving safety? Is it making the clients happier? Are you able to serve more clients, but also the midwives are less burnt out? Can you, instead of the midwife doing everything, you add on some nurses that are excellent with postpartum care, lactation consultants, they do some of those home visits that are making the midwives exhausted. Can you add a women's health nurse practitioner, a family nurse practitioner to the team that can do the newborn care past the first month of life, particularly the family nurse practitioners, but they can also fill in those gaps when the midwife all of a sudden has to run to a birth. You're not stressing and rescheduling everybody, and now the midwife has to do double work later in the week because these clients need to be seen. You can now have the family nurse practitioner, the person that's designated to the clinic 5 days a week, absorb those clients and support the ebb and flow of unpredictability of birth. So there's a lot of different ways with outcome measures to improve. If somebody's saying, man, I love my midwife, but I'm getting rescheduled all the time, there are ways you can fix it. And then reviewing your patient surveys, reviewing your staff's perception of where the stressors are and where the challenges are in the practice, looking at quality measures specifically with indicators of clinical outcomes and performance. Are we improving things by these steps being implemented? So the best practices for measuring quality improvements, you want to have objective data. I can't stress this enough. You want to have, it's not based on this person always is the problem. It's not a person. It's a system. It's your training. It's your responsibility as the business owner, the person in charge, to make integrative quality improvements that are part of the daily life. Everybody is going to get, we're going to have some positive energy because everybody is getting pessimistic. Everybody's tired, exhausted, getting burnout. Everybody is challenged to talk to each other. We need to just go to the basics and we need to get positive reinforcement, talk about the laws of attraction, give gratitude journals, reinforcing all the good things we're doing and also talking about the areas for improvement. Go back to the basics. It's really important as a leader to lead, but also to listen. And so we have to look at those quality improvements. We have to implement things. We have to have a step-by-step quality checklist. If you're checking all the supplies in the resuscitation cart once a week, you're doing it consistently the same way so nothing gets missed with inventory. If someone at the end on Friday is looking at inventory and where things are low and what needs to be ordered versus all of a sudden you're panicking, I don't have any Rogam, I just used my last Pitocin, I used my last vitamin K, I've got to call this midwife real quick and drive somewhere when I've already got a lot on my plate. It's just unnecessary things in your quality measures that add up in time that people may or may not realize. So you want to identify potential areas. Just talk about everything. Brainstorm. Even if it's something you don't want to fix today, you will prioritize. You will think differently. You will start, your team will be trained to not just do their job and their task, but they're also catching things because they're in the day-to-day operations. They're seeing something's supposed to be locked up and then all of a sudden the key is getting missed. So then people just keep that door unlocked. And for regulatory purposes, there's medications, there's safety things are getting stolen. You want to make sure you're solving the problems and that you're open to feedback from your staff, from your clients, from everyone to improve. So really spend a lot of time, have your staff meetings, have your trainings, have your quality reviews. You can make a whole committee for it, but getting everybody on the team involved really helps to improve processes because you're going to get different perspectives and angles that they can see from their job that you can't see. So you want to collect and analyze the data. After you do it, you want to say, okay, these things are consistently expiring. This is how much money we're losing. We're not putting, as soon as a box comes, we're just setting it in the corner, but then it's not getting put away. It's getting put at the front of the medications, and now the older ones are getting put to the back when things are getting stocked. Like, you really want to analyze, are we improving? Are we losing less money of unnecessary things being thrown out? Are we saving time that people don't have to search for things? We don't have to reorder something because we can't find it. Those are important processes to check on. If someone has a hard time, the only way they can get a hold of you to become a new patient is to call, but it always goes to voicemail and you don't call them back. Adding a automatic scheduling system, adding a patient portal, adding an automatic way that they can get themselves on your schedule and ask questions and get clarification will improve your conversion rate and help with that perception that you're too busy to take care of them. So you want to involve the team, you want to share the ideas, and you want to get all the teams involved and recognize and give kudos and get some challenges and have everybody meet the goals together, whether the receptionist or the person that owns the business. Everybody is accountable for these outcomes and these improved processes, and in giving a celebration when they're met and talking about, if we're close, we've improved, but we haven't hit our benchmark, what else can we do? What other creative things? How can we think outside the box? Or do we just need more time with what we're already doing? So those are just open, great, positive discussions to have. You want to continuously evaluate. Even if you meet your goals, you want to continue, make sure, maybe you don't check as often, you spread it out with time versus every week. You'll audit and you'll check once a month and then you'll check biannually, but you still want to evaluate the processes to make sure you're staying at that high caliber. Just because you've improved things, people can go back to old habits, things can go to a different routine. You really want to make sure when you're picking your key indicators and your goals that you're still doing a high level evaluation to make sure they're happening. So the principles of quality improvement, there's very core themes to make your care better, to make your branding image, to make outcomes, to make revenue streams, to make staff retention, to make less likely patient transfers, those good outcomes. Like, how do we directly, step by step, handle that brainstorming, the implementation, the follow-up, the review, and the direct continual improvement process in all quality levels. Talk about real life situations, give incentives internally, you can give bonuses, you can give, that's part of their evaluation, everybody has a project, you have a raffle, whoever gets the most community outreach referrals gets XYZ. There's so many cool things you can do with your staff, you can do with your community, you can do with just really getting people to feel empowered to not just do the bare minimum of their job, but to really be passionate and want the company's mission to be successful. So you want them to buy into quality. If you are saying all these great things are important, but they don't care, they think they're fine, they think we give great care, it doesn't matter. You have to really have good conversations. It's subjective, it's an organizational mission. If you really think that postpartum hemorrhage is an important thing to focus on and everybody else is like, we've got higher problems with XYZ and staff and burnout, you need to talk to your team and you need to really figure out the definition of quality and what is the highest quality to focus on, because maybe the postpartum hemorrhages are a ripple effect because of being tired and making mistakes and not catching things. The anemia and the iron issues are falling through the cracks and the education's not happening. The midwives are burnt out and exhausted and their stress is being brought to the birth experience. So you have to look and make sure that everybody is valuing quality improvement and we're all on the same page of what things and quality we should be working on first. So you want to focus on improvements versus accountability. You want people to be accountable for their projects and their timelines and the things they're working on. But as far as measurable data, you want to look at objective improvements. We want to make sure we currently have 6 clients a month. We're adding a new midwife onto the team. We want to get to 10 clients a month. So what do we have to do? What are we doing for marketing? What are we doing for exposure? What objective data are we going to use to make sure that improvement? We're now getting a lot more calls. We want to have a lower conversion rate. We spend too much time doing consulting meetings and then very few of these clients sign up. What are we failing in our marketing campaigns to attract the wrong clients to what our practice is actually about? So you want to be very objective. If you want to decrease your calls, but you want the ones calling to have a higher chance of becoming a client, that'll save everybody's time. So we want to get a lot of questions answered on the website, good mission, good branding, good real explanation, so that they aren't calling to ask questions, they're calling to make their first prenatal visit. So you want to establish a framework and expectations. Your culture, your environment is positive, and we're always going to be working on things. We're always going to improve. We're not like, yep, everything's good, average, I'm happy with where we are. There's always opportunities of improvement, and there's always a mindset culture of approaching things in a systematic way. We met these goals. We're going to keep an eye on them. What's our next goals? What's our next things we're going to improve? Where does everybody see our challenges currently that would have the highest impact on everything else? You want to really look, there's some different frameworks you can use. You can use the 6 Sigma DMAIC model. You can do data-driven cyclical cycles. You can do as simple as making a spreadsheet and just pulling documents and data from charting, from standards, and make your own systems. But there are some actual quality and measure systems out there. You want to define your problem. You want to make measurable changes. You want to analyze the data. How do we improve on it? Where's our control? We're going to do 2 marketing campaigns. We're going to do a marketing campaign A, that's our control, that's what we've been doing. And then we're going to start implementing a marketing control B. We're going to start doing ads. We're going to ask clients when they call how they heard about us. We started this awesome referral program. We're getting a ton of people from referrals. Like, you want to have a control, because if you want to compare what were we doing to what we are now, and insert obviously on clinical improvement. You don't want to, if you're making mistakes and errors, you want improving everybody. So it's more of like systems, having a control and a comparative. But with clinical improvement standards, you just want to implement the evidence base, the trainings. Everybody is getting the higher improvement standards. You want to talk about models of improvement. There's different ways. There's so many things. Don't rework the wheel. Just ask simple fundamental questions. What are we trying to accomplish? How are we going to get there? What are we going to do with the results now that we have them? How are we going to sustain this? How are we going to brag about it and show in data and awards and statistics and marketing campaigns what wonderful things we're doing? You want to talk about the intended and the unintended cost, data variations, manipulation, biases, placebo effect. There's so many things that can have, you may have a goal of fixing this, but then there's an unintended consequence because all the team is focusing on this, that something else falls through the cracks because they aren't thinking about it, they're not improving it. So you want to look and really have a high level quality measure of looking at unintended consequences. How can we decrease them? system, what are some things we might have come up and challenges during the learning curve, the implementation process, that we can make it as smooth as possible. So it's going to happen. You're going to have unintended consequences, but the whole point is to minimize them, to have constructive, to catch them early, to manipulate things slightly so you can continue to improve processes. So that's why it's important with meetings to have a meeting, then you meet 2 weeks later, you implement things, you start making educational handouts, you start making inventory checklists, you start doing patient surveys you hadn't done before, you start continually adding and improving things because regulations change, systems change. Your business is always either growing or shrinking. It's never staying the same. So if you aren't intentionally trying to improve quality, you're not intentionally trying to grow and expand and brand to the next level, you're going to start having quality issues. You're going to start decreasing client numbers. You're going to start having challenges because you're being stagnant and not spending the time to improve and grow. So just as an overall summary, it's so important for quality. I think as midwives, we get so tired and exhausted and we think, I'm giving great cares compared to the hospital system. I'm at an 8% C-section rate. They're a 33% C-section rate. My breastfeeding rates are better than the normal traditional system. We have to get out of that mindset. We can always do better. We can always, what if you can get an 8% C-section rate down to 2% C-section rate? What if you can now get a better marketing campaign that you're getting stronger ideal clients your direction and not hearing from their friend at a 6-week visit, I wish I would have known about your services. It's our job to take it to the next level. We are only comparing to ourselves and growing from ourselves. If we compare to the below subpar terrible averages of what our competition is doing, we're never going to improve our quality and our outcomes. We need to always be really thinking about how can we improve things, how can we improve staff training, culture, how we're onboarding clients, how we're teaching them, what resources we're connecting with, transfers, the talks, the flow of how long they're at our office, how long they're sitting in the waiting room, how many clients we have in labor, and how we're restocking and how we're documenting and how we're billing things out, how we're getting paid. Like, there's so many things for quality measures you can focus on. You just have to start prioritizing which one is having the biggest impact. Safety in front of patients should always be the forefront. But if your revenue streams aren't the best of what they can be, you're eventually going to have to close. Then you can't serve anyone. So that's definitely important. Think of all the quality improvement measures and processes you can implement and follow through with them on an objective